are all very active when it comes to social media. Thus, I want to use you to spread the word. So hashtag unlocking the power of being is what you need to do. And do tag us on our sites, which is MHFI, AIMS, and Mind Specialists, which is an online initiative of Rahat. So we have more information on our websites of www.mhfi.org. Hanji, www.mhfindia.org, www.rahat.org, and www.mindspecialists.com. So you can check us out over there. And this particular session has been very much sponsored by our very beloved sponsor, who's a platinum sponsor, Wakrangi. So big thank you to you. यहाँ पर जितने भी participants, I would request you to kindly pay attention to what our special speaker is about to address and enlighten us about. And whatever questions you have, you can put it in the chat box so that they can be discussed later on when the Q&A session opens. With that being said, ladies and gentlemen, it's an absolute joy in welcoming a fellow citizen of the world. Why I say the world? Because all the way from Australia, he's joining us. And he is a powerhouse of knowledge and wealth when it comes to giving guidance about the essence of health. And that's what he's going to talk about, the essence of health. Our speaker for this session is Professor of Consciousness and Contemplative Studies, Monash University, Melbourne, Australia. So all the way from down under, Professor is joining us. And I would also like to invite our very lovely and beloved Professor, Professor Nand Kumarji, who is the President, Mental Health Foundation, India, and Professor, Department of Psychiatry, and in charge, Neuromodulation and Mental Health, AIMS, New Delhi, India, to take this session forward. So Nand sir, over to you.
Thank you very much. Thank you very much, Anuridji. Thank you very much. Hi, Professor Craig. Can you hear me?
Yes. Thank you.
It's just no privilege and honor to see you and to little bit say something about you. Very, very warm welcome to this show. Your wonderful talk that we are going to listen. Just for the audience, I would like to just say a few words about Professor Craig. He's a Faculty of Medicine, Monash University since 1989, and he's the coordinator of Mindfulness Program in Monash. His area of interest is wide and so varied. He's deeply interested in mindfulness, mind-body medicine, lifestyle medicine, integrative medicine that is need of the hour perhaps in today's era, and of course medical ethics perhaps much needed. Without that, perhaps we can't survive as a medical professional. It's excellent and wonderful to know that he has launched world's first mindfulness-based healthy lifestyle course, that is Health Enhancement Program, and this is running in collaboration with various universities in Australia and also internationally with similar kind of content under the guidance of our dear Professor Craig Hassed. He has published more than 13 books, and last but not the least, in 2009, he received a Medal of Order of Australia for service to medicine. His excellent, adorable service to medicine. Not only this, he's a star in Connection feature documentary. So he's the star academician, star researcher, and a star spiritual meditator. Welcome, sir.
Thank you very much. It's a real honor.
Please deliver your talk.
Thank you. It's a great honor to be invited to present to you and everybody on this call today. I'm going to speak a little bit about the work I've been doing for a long time to try and bring lifestyle medicine and well-being to medical students. Firstly, to help their own mental and physical health, but secondly, to have more informed and holistically minded doctors to one day help their patients. And I don't think it's very easy to help our patients unless we help ourselves first. So I'm going to present, and I'll be very much looking forward to your questions after my presentation. So let's just move to the presentation now, the essence of health, and I'll explain what that's all about. Self-care for medical students, Monash's Health Enhancement Program. So I'm just going to give, first up, a little bit of a history lesson. Looking back down over the decades, there have been many, many studies, and I'm talking about thousands of studies, to show that the mental health and well-being of medical students in particular, but also other health professionals as well, is not always as good as we would like it to be. So medical students, for example, at the start of their medical course have very similar mental health to the general population. If you look at the levels of stress really start to express themselves from first year in medicine, and depression and burnout become much more common, especially the further the students go into their medical course. And relevant to other courses, medical students have higher levels of psychological distress, and particularly in the pre-exam period, depression often doubles after the commencement of the course. So the closer to assessment and the further on in the medical course, the worse the mental health tends to be. These are just a few examples of some studies that illustrate that point. And one of the things also, of course, that selects for medical students is a tendency to be a little bit obsessive and compulsive in thinking that we can know everything and being a perfectionist, and these kinds of psychological traits tend to put doctors or medical students at risk. Now, some of you might feel like this, you're carrying way too much load as you're trying to get through all your studies and everything else, but it doesn't end when we finish our studies. This is, I'll just mention, the only study of its type in the world that actually looked at what happens after graduation. This is an Australian study published in the Medical Journal of Australia. And what they did was they measured mental health during the medical course, and they found that halfway through final year medicine, 28% of medical students had burnout, using Maslach's burnout inventory. But every 3 months, throughout their first year of working life, they measured burnout and also rates of mental illness. And what they found was that by 8 months into the first year of working life, 75% of interns qualified as having burnout. And when they looked at the rates of mental illness, nearly 3/4 of the interns would have qualified as having had a mental illness on at least one occasion just in the first year of working life. Now, the lifetime prevalence of mental illness is meant to be somewhere between 20 to 25%. This is 73% just in the first year. Anxiety disorder and depression were the two leading causes, and then there were a much smaller number of those who experienced psychosis or major drug addiction. But anxiety and depression were by far the two biggest causes of mental illness. Now, there are many ways of looking at figures like this. What I would say is that this points to a major deficiency in how we train professionals to do a demanding job. We think that we've prepared a doctor to do their work if we've given them some technical skills and knowledge. They know certain things about drugs and certain procedures they can do and how to put in an IV line, etc. But if we haven't trained this person to manage the personal and emotional demands and the stresses that go with the job, then I don't think they've actually been properly trained. And this points to a major deficiency, I think, in how we train medical students and other health professional students to do their future work. So, history does not have to keep repeating itself, but it will unless we do things differently. Now, I always think that it's useful to try and measure problems and measure things that are wrong. But to me, it makes much more sense to actually be interested in doing something about it, to find solutions. Because I think that when I was going through medical school, and there were certain times as a junior doctor when I felt very challenged, and I had to teach myself self-care. I had to intuitively really apply and practice the things that I now teach, but I had to do it myself. And it made a big difference to me, and it sowed in my heart a very strong commitment to try and not only help patients to stay well, but also to try and support the next generation of doctors coming through. So I got involved in medical education to see if some of this kind of self-care and this more holistic perspective could be brought into medical education. And Monash University in Melbourne. It's a large university with about 80,000 students, but not all medical students, of course. We've got about over 2,500 medical students, but it was a very innovative and a very sort of open-minded sort of environment. So there was the possibility of doing this work. Now, a multiple choice question for you. This is not going to be an exam. You won't get a pass or fail, but how much more likely is a depressed doctor to make medication and prescribing errors? Multiple choice, so no more likely, 6% more likely, 60% more likely, 600% more likely. I'll just give you a moment to reflect on which one you think it might be. Well, the answer is D, 600% more likely, at least according to this study in the British Medical Journal. In this study, they were looking at 3 hospitals in the United States, and they measured burnout and mental illness among the resident medical staff. And they found that 20% of the resident medical staff qualified as having clinical depression. That's among those who are working. They also found very high rates of burnout. But what they found was the depressed doctors made more than 6 times as many medication and prescribing errors as non-depressed doctors doing the same job. Not 6.2%, 620% more likely. So now, this is important in terms of self-care. Sometimes people in the helping professions think, well, I really can't afford to take time for self-care because I'm too busy looking after others. And that is very, very admirable. But we need to distinguish between self-care and self-indulgence. And I say to the students on day 1 of their medical course at Monash University or anywhere else I speak, I say that self-care is an obligation that you have to yourself, and your university education should try and support you in doing that, give you skills and attitudes that are very conducive to doing that. But secondly, your investment in self-care is also an investment in the well-being of the patients that you want to look after. If you look after yourself, you'll be much more able to look after your patients effectively, compassionately, and safely. And of course, if we're depressed, then the attention's not properly on the job. What is the attention on if we're experiencing depression? It's probably on rumination and negative self-talk and self-criticism, which means the attention is not properly engaging with the work. So both our mental health and our ability to function well suffer. Now, so why do you need to learn about this? Well, this is what I say to the students, that a university should have a commitment to students' well-being. It should be a core objective of university training to support and enhance students' well-being, so that, and this is again what I say to the students, they should graduate with better mental and physical health than when they came into the course. It makes no sense to me that you could enter a medical course and then spend years learning about what is meant to be health and understanding health and illness and graduate with poorer mental and physical health at the end. That makes no sense to me at all. So the student's well-being should be valued in its own right, but also we're interested in producing holistically minded health professionals, and also a curriculum which is holistically minded, that is, can integrate the very important biomedical sciences with the psychological and the social sciences. So we understand how the mind influences the body, how our social environment influences our well-being, and how all of this impacts on clinical practice. We also need to understand the poor history of student and doctor health. We also need to have, when clinicians these days often have way too little biomedical knowledge and clinical skills as far as lifestyle and stress management are concerned. There's hardly any curriculum in nearly all of medical courses around the world where there's a significant amount of time spent on the importance of lifestyle issues and stress management. Now, lifestyle issues matter more and more and more the more affluent a country becomes, because lifestyle-related illnesses generally are problems that arise when a country becomes affluent and starts to eat more processed food and becomes more sedentary in their lifestyle, have more labor-saving devices and so on. But also mental health tends to go in the wrong direction as well. And so many patients experience stress, may not even be to the point where they're experiencing major mental health problems, but just the stresses of day-to-day life. And so we can't keep graduating clinicians who don't know about this area of their work, because patients will be presenting with these problems all the time. Now, lifestyle and stress management are therapeutically powerful. And I'm going to give you some examples later on to illustrate that point. And doctor well-being improves clinical performance and patient care, and it also reduces clinical errors. And all of these reasons matter. So we teach our students at Monash, and it's not just the medical students, also physiotherapy students and pharmacy students and psychology students. They all have this kind of content in their curriculum. But the Health Enhancement Program was started in the medical school by myself, and it's a mindfulness-based lifestyle program. And I'll say more about mindfulness later, but it's a form of meditation, it's a way of living, it's an approach to mental health problems. But it's mindfulness-based, that's the foundation, and all of the important lifestyle elements. And it's a core part of personal and professional development. It's not an elective for the students, it's core curriculum, and it comes up in first semester of first year. So there's a series of lectures. Now, the lectures are important because unless the students, who are very scientifically minded, unless they're given the evidence, the science, the clinical applications of these things, the students tend to think it's not important. It's not a serious part of the medical course. So got to give the students the science and the evidence around this, and that's what the lectures do. It sets it in a clinical context. And then the important learning starts in the tutorials. So having had background of that information, then the learning through experience. So we say to the students, if you were maybe one day a doctor and you had patients coming in and you were taking stress management classes or you're taking lifestyle management classes, then you might take patients through a program something like this. And we say, if you want to learn how to do this in your later clinical work, then learn how to apply it. Go through the program yourself. We're going to take you through the program and you can apply these skills to yourself. And it comes up in first semester from weeks 8 to 12 in the first semester. So as I said, mindfulness and the Essence lifestyle program. So, and I'll say more about that in a moment. In second semester, we also give them some content on positive psychology, improving performance, mental health enhancement, and then they get further input in third year when they're in the hospitals and doing clinical rounds. We then have a follow-up health enhancement program looking at these things in clinical practice. Now, the Essence acronym, so the Health Enhancement Program is based on an acronym. And if your medical students in India are very much like ours in Australia, I suspect most of the curriculum is based around acronyms. Now, Essence stands for education. Now, education, as I mean it here, is not just sitting in the lectures and having information and so on. It's also learning about ourselves, because very often what we think and what we do are two different things. Like some of you might know that something is good for you, but you're not doing it. You know that exercise is good for you, but you don't do it. Or you know that eating a healthy diet is good for you, but you don't do it. Or sometimes we know something is not good for us, but we keep doing it anyway, right? So So we need to understand our own minds, our own motivation. We need to understand ourselves. All the world's great wisdom traditions have at their heart, know thyself. And so education is, in a very broad sense, and its most important level is to understand ourselves better. Then there's stress management. And so this includes the mind-body relationship, mindfulness. So this stress management includes all of this area. Spirituality. So where do we find meaning and purpose in life? What are the bigger questions in life? And this matters not only for finding meaning when we're dealing with adversity ourselves, but also how you're going to help patients to find meaning in their lives, to find the spiritual dimension when they may be facing life-threatening illnesses. So spirituality. Exercise, the importance of physical exercise on health. And if we could bottle the benefits of exercise in a pill, that would be a very expensive pill and very widely prescribed. But exercise is very, very powerful medicine in itself. The importance of healthy nutrition. And one of the unfortunate things, of course, as countries become more affluent, there's less and less whole food and less essentially vegetable-based nutrition. And we tend to become more and more focused on processed foods, foods with too many empty calories in them, not enough fiber, and luxury foods, etc. So our nutrition gets poorer and poorer as we become more and more affluent, which is really a nonsensical situation. So the importance and the healing power of food as medicine, if you like. Connectedness. So this is our social support. This is our sense of community, our connection to others. And of course, this is very important. If we don't have close and supportive relationships, people that we can talk to about really important things in our life, then we're going to be far poorer in terms of our mental and physical health. And then there's the importance of a healthy environment. And when we talk about environment, we're not just talking about having clean air to breathe and clean water to drink. All of those kinds of things are very, very important. But we also mean the social environment that we're in. The learning environment that you're in at university, for example, environment, how we build our cities, having green space to go into, our connection with nature. All of these things influence both our mental and our physical health. But that's the essence of health. And that's the essence of preventing chronic illness. It's the essence of treating chronic illness. And this is not instead of conventional medical care. What we're talking about here is doing all of this with or in conjunction with the best that modern medicine has to offer. So we're talking about getting to the underlying pillars that support health. Because if we just try and use medical treatments to treat chronic illnesses like high blood pressure and type 2 diabetes and all these various things, but so if we just use the medications, but we ignore these underlying factors, then we're not going to be very successful in our treatments. So we need to use all of this as our first line of preventing or managing chronic illness, and then use the judicious use of the best that modern medicine has to offer. And that's a much more powerful combination. But for our students, we, throughout the tutorials, the students reflect on each of these elements for themselves in their own life. They apply these lifestyle factors to their own life and look at meaning in their own life, practice mindfulness themselves. So that's the way that we go about it. So learning through experience, not just through theory. So the objectives of our Health Enhancement Program, as I said, it's a part of our personal and professional development. It's not an elective. All the students do it. We want them to develop positive attitudes and practices in relation to self-care. And we want them to also be thinking more preventively and more holistically in their future medical practice. We want them to be able to build a foundation for future clinical skills in lifestyle management, motivational interviewing, how to help patients to make healthy changes in their own life, managing stress, and what's called enabling strategies. Because when we just tell a patient to do something, it doesn't necessarily happen. You've got to empower and enable the patient to be able to make healthy changes for themselves. And we take the same approach to our students. We're not just trying to tell them you should eat this, you should exercise, you should something else. We help the students to feel more enabled to make the changes that they want to make in their own life, because they're in control of their own life, but we want to just enable them and empower them to make those healthy changes if they want to. We encourage self-directed learning, so to apply these skills outside of the tutorial rooms, and to integrate learning with all the cases and all the other themes that they're learning about, like biomedical knowledge and clinical skills, so they apply this. It's connected with all of the other elements of the curriculum. So our philosophy is it's an experiential and deep learning model. So the students learn by applying. And as we say to our students, you will apply the program to yourself, right? So that there's, through that application, there's the opportunity for personal benefit, plus understanding how it applies to our patients. Now, mind you, at the end of the day, it's the student's own choice about whether they make any changes in their life. We can't, and we don't want to be dictatorial and tell the students what they have to do. But we do want to give the students the opportunity to explore how they could apply these skills. So the participation in the practical activities, like practicing mindfulness, like making changes to diet or exercise, etc., is obviously encouraged, but it's entirely voluntary. But the students not only in their tutorial groups discuss each week, how have you gone? Have you made changes? If not, what do you notice gets in the way? If you have made changes, what's the effect of making those changes? And the students also keep a weekly journal. So they write each week a page that they give to their tutor about their experiences, their questions, their challenges, their insights. And the tutor gives them personalized feedback each week through responding to those journals, and obviously collectively in their tutorial groups. And we integrate it with their problem-based learning, their cases they're doing. Now, one of the other important parts is, although personal application in their own life is entirely voluntary, the assessment is not. So the core knowledge, the core principles they're learning about, they will be assessed on in written exams and in OSCE exams as well, or clinical exams. Now, if something, and if your medical students, if you as medical students are like ours, if it's not accessible, if it's not on the exams, then it's not a serious part of the curriculum. So that assessment's very, very important. And it does help to drive learning and engagement with the course. Now, just to say a few of the studies we've done with our students, this was the first study we did, where we followed the students. And what we did in this particular study is we measured the students' mental health and well-being early in the first semester of their first year. So it was a low stress period of semester. And this was prior to having the Health Enhancement Program. And then we measured their mental health and well-being at the end of the semester and after they'd gone through the program. What we found was everything we could measure about the students' mental and emotional health and their quality of life had significantly improved, despite the fact that after the course we measured their well-being immediately prior to mid-year exams. We should have seen depression and anxiety and stress go up. We should have seen quality of life go down. We found the opposite of that. And what we're also interested to find, there was 90% of our students said, outside of tutorial times, I'm practicing mindfulness and I'm making healthy changes in my life. That is, 90% of students said, I'm using it and I'm making healthy changes in my life of my own choice. And we found that the more the students made healthy changes, of course, the better they were. So it's a very high level of engagement, I think, because we gave them evidence, we gave them skills, we gave them support. We didn't tell them what to do, but we explored how making healthy lifestyle change and so on is not easy. So we look at the barriers and the challenges to making healthy change. So the students were learning about themselves, and we're certainly very encouraged. We've done some other studies. These are a few of the studies that we've done, again, with our students. And what we found was, and this was a smaller study that we did, but there was a significant increase in mindfulness by the end of the program. And the more mindful the students became, the more they engaged with their study right across the curriculum. So as they became more mindful, they were much more able to focus on their study more effectively. What we also found in this one was there was a tendency to improve mental health again, but we didn't have the statistical power to be 100% sure, but we certainly know there was no increase in depression or anxiety or stress in the pre-exam period, again, confirming what we previously found. This was a study by the education faculty studying our medical students. In this study, we looked across the 5 years of the medical course. So not just the first year students, but second, third, fourth, and fifth year. And we measured not only some demographics, but also their level of mindfulness using the 5-facet mindfulness questionnaire. We also looked at a lifestyle assessment and the depression, anxiety, stress scale. And we wanted to see how were the students tracking across the 5 years, and were they still using the skills that they learned in fifth year? What we found was that the more mindful the students became and the more they were still applying that in their day-to-day life, there was a significant moderator of the relationship between self-care and psychological distress. That is, the more mindful the students were, the less distress they had, and the better their self-care. And that included not just being more mindful, it meant that they were more likely to lead a healthy lifestyle as well. So we're certainly very encouraged by that. So student well-being in the medical curriculum. This was an article in the New York Journal of Medicine, and I spoke at Harvard when I was visiting Boston some years ago, and they were very interested in what we're doing with our medical students at Monash, and started using the mindfulness program we ran for our Monash students there as an elective for the Harvard students. A more recent paper in medical education by a team at McGill University were talking about mindfulness in medical curriculum. And by that stage, Rochester Medical School was also using mindfulness principles in their curriculum. And they had a different emphasis to where we put it in our curriculum. We had our mindfulness training early on in the curriculum to teach the students about well-being and self-care and so on. At Rochester in the United States, Ron Epstein was doing this work. He was teaching it more as the students had more experience. So they were a few years into their medical school, and he was teaching it as something that helped them to focus better in the consulting room, to be more aware of their decision-making processes, etc. So it was for more advanced students in their curriculum. Now, I'm just going to say a couple of things as well about how important lifestyle is. This is some Australian data, and just looking at increase in life expectancy in Australia over the decades. And there's been a massive increase, and similar things would be happening in India and all around the world, of course. So this is very good news. Now, mind you, you see a little plateauing in the 50s and 60s. That was because of the increase in smoking-related lung disease after the Second World War, when people are smoking more. And then you see the life expectancy goes up again after smoking cessation programs started to reduce the amount of smoking. So we only have about less than 15% of people in Australia smoke these days, which is much better than it used to be. So this is just a quote from myself in an article I wrote about 20 years ago. And this was an article about life expectancy. So those living to an average age of 82 now, that was in 2002, were born in 1920 under very different social, economic, and environmental conditions to what we're now experiencing. The negative impact of a range of lifestyle factors and mental health factors may be underestimated, and if so, we may see life expectancy peak between 2020 and 2030 and then begin to decline. So that was my view, because all these very bullish predictions about life expectancy is going to keep going up and up and up. My hunch was, with less and less healthy lifestyles for many children and adolescents and young adults, that takes 10, 20, 30 years to play out in chronic illness. And unless that lifestyle improves, we're going to see this increase in chronic illness at an earlier age. So we have to train students to understand these things. Now, what's interesting is, if you look at some big data, say in the United States as well, life expectancy is now decreasing. According to data where they've been following over decades, it was going up and up, and in the mid-2010s, it started to go down. And that's for the first time ever recorded in history, that life expectancy is going down. Now, mind you, it's even dipped further with COVID. And so if you follow the data, the rate of chronic illness in those in their middle years, the 25 to 64 year age groups, chronic illnesses are very much on the way up. And so the early mortality is caused by drug overdoses, alcohol abuse, suicide, chronic illness, and lifestyle-related diseases. And so the implications for public health and the economy are very substantial. Now, as India, of course, becomes more affluent, these kinds of lifestyle illnesses are going to start to become much more common in India as well. So this is like, if you like, a tsunami of illness or a tidal wave of illness coming towards us. And we have to be prepared. Heart attacks in the young. This is Australian data, and a 30% increase in the number of heart attacks in the under 35 age group in Australia. 30% increase in one decade from 2002 to 2012. And so in Australia, 20 to 30-year-olds getting fatter, less active, higher cholesterols and blood pressure than previous generations. And many think they're immune to serious illness. And of course, the risk factors for chronic illness are going up significantly. And so these were things that we used to see much later in life, and because of unhealthy lifestyle, we're seeing them early. And this is a study from 89 countries around the world, over 300,000 adolescents. And this is a picture that's happening all around the world. 82% of adolescents had 2 or more risk factors, while more than a third had 3 or more risk factors for chronic illness. And 16 to 17-year-olds compared to 11 to 13-year-olds are 33% more likely to have at least 3 risk factors. So that is, as children go through into adolescence, the further they go, the more of these risk factors they have. Physical inactivity, poor fruit and vegetable intake in males and females. And these unhealthy lifestyle factors tend to cluster together. And not, of course, in life, medical students are not immune to this sort of influences in society more broadly. So these are things that we need our students to understand personally, but also to understand for their future work. And lifestyle and life expectancy, just to get a sense of how powerful lifestyle factors are. This was looking at the influence of lifestyle on premature mortality and life expectancy. And they looked at 5 lifestyle factors: smoking or not, having a healthy BMI, at least doing 30 minutes of exercise on a daily basis, just not necessarily abstaining from alcohol, but just at least a moderate alcohol intake, and at least being in the upper 40% for their dietary quality. And so they had followed them over a 34-year period, so exceptionally long-term follow-up, and looking for the hazard ratios for mortality. So the chance of dying, if they had 5 of those factors, that is healthy lifestyle, or if they were not able to tick those 5 lifestyle boxes, as it were. And if the person had those 5 factors, they were 74% less likely to die over that 34-year period from any cause, 65% less likely to die from cancer, and 82% less likely to die from disease. And when you actually look at it, if you measure somebody's life expectancy, if they've reached 50, then what they found was that for those who didn't have those healthy lifestyle factors, they could expect on average, if they got to 50 already, to live for another 29 years. For women, if they could tick those 5 boxes, they could expect to live for another 43 years, and many more of those years of life lived healthily. For men, on average, another 37.6 years. So something adding 14 years to life expectancy, that's a big difference. And it's not just the amount of years, it's the amount of years lived healthily. Now, I'm not going to have time to get to it because I want to stop in a moment and take some questions. But in terms of lifestyle interventions, probably the gold standard in terms of research around the world was the program developed by Dean Ornish. He was very influenced by yoga principles when he was a medical student, not just doing physical postures with yoga, but yoga lifestyle. And that included diet and meditation and so on, because he had poor mental health himself. So when he adopted this yoga lifestyle principles, and it made a big improvement in his health. And so when he became a cardiologist, he developed the Ornish lifestyle program, and he applied it to people who already had heart disease. And what he found was that if people already had heart disease, if they adopted this program, they actually reversed their heart disease. So they were doing angiograms, and they found that people actually on this healthy lifestyle program, the coronary arteries were opening themselves up, right? And mind you, for many of them, if they keep getting worse and getting more angina, they had to go on and have operations. When they followed up 5 years later, if they went through that lifestyle program and they lived it in their day-to-day life, they were even better 5 years later than they were 5 years before. And also, they noticed that there were 2.5 times as many major cardiac events and deaths in the group who just had the usual medical care by itself, rather than the usual medical care plus a comprehensive lifestyle program. So this is powerful medicine. There is no medical treatment that comes close to doing that. This is powerful medicine. And he's done research as well on prostate cancer, for example, type 2 diabetes. And this is the kind of medicine I think we need for the future, because if we don't get back to first principles first, then healthcare becomes very expensive and less effective. So that's where I'll stop now. I've tried to make a case as to why applying these things in your own life matters and why it matters in your future clinical work. I'll be very interested if there are any questions, any things you want to say or to ask about anything I've said up until now. Good.
Thank you. Thank you very much, Professor Craig. Excellent talk. And in the institute, I belong to All India Institute of Medical Science. I'm professor of psychiatry here. So I think some data we share with you. Say, for example, burnout. Burnout is approximately 75-80% in our resident doctors. But no, this is perhaps something like unheard of. Like 600% resident doctors are more perhaps likely to make an error in prescription. It's a very hardening impact, and we need to be very, very careful. I'm very much impressed, and I'm very keen to know your recent lifestyle program. Here in India, since last few years, we are trying to have some program like this. We have tried with some programs, what we call CREST, but perhaps some issues are there. I think this can help us a lot, and certainly I will discuss about this program later. There are a lot of questions for you, in fact.
Good.
I think the question one is, like, sir, in your opinion, should there be a special structure created for medical and health professionals where they can be more open about their mental health, which is free from prejudices and judgment from all? I think partly you have answered through a program, but still the question is there. I think we can have perhaps more elaborate answer.
Yes, it's a very good question. And so one of the important things about the tutorial is the tutorial almost operates like a support group. The students come in as if they're doing a health and well-being program in the community, for example. Well, you come into the program and you experience it from the inside out. And so the tutors are very experienced health professionals themselves, and they facilitate a conversation, a safe and respectful conversation. And bit by bit, as the weeks go on, and the students just sort of talk about how they're really feeling and the struggles they have, or they talk about the things that they're actually applying that they're finding very helpful. As the students talk about this, there's a kind of environment of support among the students, and they start to be much more open and authentic with each other. And it breaks down a bit of that fear and the stigma, because students very quickly realize, I thought I was the only one feeling this. When I'm giving them a lecture, for example, and we're talking about mindfulness and how the mind wanders, and I say, do you ever notice that you're sitting down trying to get your study done, and your mind wanders off to thinking, how am I going to get through all of this work? And everybody else in the medical course is so smart except me, and how did I get into it in the first place, and what if I fail? And all the students are going, yeah, that's me. And they realize that they experience very similar things. So it breaks down that sort of sense of isolation. They have more respect for each other. Now, mind you, sometimes a student will have a conversation with a tutor after a tutorial, or maybe they might write something in their journal, that indicates they've got a more significant mental health problem. And we don't want this tutorial for the student to all of a sudden start talking about the major depression that they're having, for example, because it's not set up to be that kind of intervention. But the tutor might have a conversation with the student just quietly and one-on-one, give them some support and so on, but help the student to encourage the student to see a mental health professional, like the university counselling services or their doctor, so that they can get some professional support that they might need. But this is really built up a very supportive kind of environment for our students, because we need to break down this sense of isolation and thinking that we're the only one that feel that way, when pretty much everybody else in the course feels that way too.
Thank you very much. Another one interesting question is, sir, could you please elaborate upon the relationship between epigenetics and spirituality?
Epigenetics and spirituality. Yes, I was going to say a little bit about epigenetics today, and I suppose there's a number of ways you could look at that. For example, if you think about life and the human body in a metaphysical way, in the way that the world's great wisdom traditions might have looked at it, then consciousness is primary, then you've got the mind, then you've got the body. And what we give our consciousness to in the mind, angry thoughts, negative thoughts, etc., has very strong effects in the body. If we give our attention to anger, for example, very strong anger, then we can make it more likely to trigger cardiac events, etc., increase our stress. So this sort of more metaphysical way that understands that there's this continual interaction between consciousness, mind, and body helps us to understand the mind-body relationship, but also what often drives illness. But it's interesting to look at, say, things like mindfulness, for example. And we know, take some of the research on telomeres. I'm not sure if your students have heard much about telomeres, but they're like a marker on our chromosomes of our biological age. They're the little caps on the end of the chromosomes that stop the chromosomes from unraveling, like the little plastic bits on the end of shoelaces stop shoelaces from unraveling. And what's been found is that psychological and emotional stress will actually shorten those telomeres fast. So we can be, if we're more stressed, about a decade older by middle age compared to somebody who might be doing the same job but has less stress. But also, if we have a tendency for the mind to wander all the time, and generally it wanders into worry, then the more a person's mind tends to wander, the shorter the telomeres are. The older, we're aging fast down to the DNA of our cells. Now, the positive side of that is that the research also shows, and Elizabeth Blackburn's an Australian woman who won the Nobel Prize for Medicine in 2009 for discovering telomeres, what they've found is that when people practice meditative exercises like mindfulness, it switches on the repair enzyme called telomerase and slows down the rate of shortening of the telomeres. It actually literally slows down the aging process down to the DNA of the cells. So I find it very interesting that these ancient exercises, contemplative, meditative practices, do not just relax a few muscles in the shoulders and the jaw and so on. They don't just drop a person's blood pressure a bit or down-regulate the inflammatory chemicals. They actually slow the aging process on the level of the DNA, and even looking at other genetic effects, it down-regulates, it turns down the activity of the genes that regulate the stress response. So there's some very interesting work in epigenetics that in a way would not surprise the wise sages from time past. I think they'd say, well, that's interesting. I'm not surprised by that, but I find the mechanisms absolutely fascinating. Well, I certainly do anyway.
Thank you very much. In fact, a lot of research are, I think, being done, and the spiritual practices are basically that perhaps it's change your DNA expression through epigenetic mechanism. Another question is, how can spirituality help in coming out of recent negative life events? I think this is more relevant in terms of the recent COVID waves. Like a lot of people have lost their family members, near and dear ones, and perhaps they could not participate in the traditional rituals also when the person departs from this physical world. So perhaps that question is so relevant. In fact, how can spirituality help in coming out of recent negative life events?
Yes, it's a very important question as well. When people go through really challenging or adverse life events, a significant proportion will come out with PTSD, post-traumatic stress disorder. But there's probably as many who come out of those difficult events with post-traumatic growth. That is, grow through adversity. And there's a few things that help people to do that. A strong sense of spirituality can help to give people an inner stability when things are very uncertain and challenging outside. It's like giving a person an inner strength that helps to hold them and maintain them in times of adversity. Making meaning is a very important part of that. And that's one of the things. There's a review of many studies looking at meaning in life and how mindfulness is just a way of increasing awareness, how that greater awareness helps people to find more meaning in life. One of the things that when we become more aware, we realize that things are inherently uncertain. We think, we get in our car, we're going to drive to work, we assume the car's going to get us there, and maybe it does, or maybe it breaks down one day, who knows? We never really know what the future will be. And we understand that things are transitory. The world is transitory. Things come and go, success one moment, failure the next, pleasure one moment, pain the next, gets warmer one day, colder the next. Life is a little bit like that in a cyclical way. And if we get totally consumed by, identified with, caught up with all these changes in life, and we forget that still point in the center of our being, then we get tossed around by it. If we view these changes, view the movement around us, but from that still point of the core of our being, and I think that's where spirituality really lies, then we don't get tossed around by it so much, but we can also learn from adversity, be improved by it. And that doesn't mean that the adversity just becomes easy or it becomes pleasant. It is what it is. But we will find a resilience that we didn't know that we had. I don't know if any of you followed the story with the Thai boys soccer team that got trapped in that cave a few years ago. And they were in that cave with rising water levels for about 10 days until they found them and managed to get them out of that cave. So they were trapped and they were there for the best part of 10 days before they were found. But the coach, the soccer coach, was a meditation teacher. So they practiced a lot of meditation in that dark cave over that 10-day period. And when they found the boys were incredibly calm. They coped incredibly well, not just with that time they're in the cave, but getting out of the cave. When they interviewed them later, the boys didn't talk about how they were traumatized by the experience. They all talked about how they grew. They learned more about themselves. They found strength in themselves they didn't know they had. And you see, this is like buried treasure. And we have to turn towards adversity. If it's there, it's there, and learn to work with it. But we have to understand ourselves in a deeper way. So I think there's some of the ways in which spirituality and coping with adversity can really help.
So well said. I think the role of resilience is perhaps very, very important. And spirituality makes her more resilient, and that can perhaps help us a lot.
Yes.
Get rid of negative emotion, negative events. One of the question, I would supplement this question, and I wanted to ask this question. This question is asked by Adil Hakim. This question is, HEPs are recommended as a part of the curriculum, or it's a voluntary program?
So the general practice?
HEP is recommended as a part of the curriculum in your institution, or it's a voluntary program? And this is also for UG and PG, or only for UG and PG?
Sorry, if I'm understanding the question correctly.
There is a question asked by Mr. Adil Hakim that HEP program, that what we have mentioned, is it recommended as a part of the curriculum?
Oh, yes.
Or no, it's a mandatory, or it's a voluntary?
No, it's an integral part of the curriculum. The students can't pass first year medicine unless they complete this program. So as I said, although the program is in that sense compulsory like any other part of the curriculum, we very much respect the students' own ability to choose whether or not they live that aspect in their life, whether they practice the things that they learn. But the knowledge that we expect, and completing their journals and doing the course and reflecting on life and lifestyle and how, all these things, that's a core part of the curriculum. So it's not an elective. We're the first university in the world to actually have something like this as a core part of the curriculum.
Okay. Another part of the question is, this HEP is both for undergraduate and postgraduate students, or it's only for undergraduates?
This program is there for the undergraduate students in first year. And then it comes up, we have elements later on in first year, and then they get some elements of it in third year as well. But they can, in their later careers, they can do some training and lifestyle management and so on, but that's not a part of our course that we have for our undergraduate students.
Okay. Thank you, Professor Craig. I think we are just passing the time. Just one thing from my side, I would like to ask. In India, we have a National Medical Commission that looks after the medical education. And we have some module like that focuses on attitude, ethics, and communication in medical curriculum, mainly for the undergraduates. So I think, is there a possibility, like we have a lot of international collaboration, is there a possibility that we can collaborate with you in future?
Yes, I'd be very happy to share our experience and to help you to develop a curriculum for your medical schools in India, if that would be helpful. I'd be very happy to share our experience and help in any way I can.
Thank you, Professor Craig. I'm really deeply I express my gratitude. I'm so grateful. We have learned a lot from you. Thank you very much. Thank you very much for part of this program, and I'm genuinely grateful to you. Thank you.
Thank you. It's an honor. Thank you very much.
Thank you.
All right. A big thank you to both of you, to Craig sir and Nanta, for giving us your precious time. And I guess it's time, another 2-3 hours, it'll be time for dinner when it comes to Australia, especially where Craig sir is right now. But now I can see is the time for lunch. So we are breaking for lunch from 1 to 2. We reconvene at 2 o'clock sharp. So in case you have missed something, I suggest you do not miss any more, because we have a very special sessions coming for you. So be alive, be energetic, and be super ready. All you need to do, get some energy with lunch, and you're good to go. See you at 2 o'clock.
Thank you. Thank you very much.